Broadcasting live from the Bloomberg Interactive Brokers Studio in New York. Bloomberg 1130 to Washington, D.C. Bloomberg 99.1 to Boston. Bloomberg 106.1 to San Francisco. Bloomberg 960 to the country. Sirius XM Channel 119. And around the globe, the Bloomberg Business app and BloombergRadio.com. This is Bloomberg Markets.
I want to get to Waqaas Al-Siddiq. He is the CEO and founder of Biotricity, and they are trying to improve healthcare by developing basically digital solutions, aiding in chronic disease prevention and management. Waqaas, I was thinking about your company, and you can tell us more about it, I guess, in your answer, but it dawned on me, I've always had this kind of negative view of the metaverse or a future living in virtual reality from movies like WALL-E and what's that one with Bruce Willis where he plays a cop in the metaverse?
Yeah.
In any case, I always have thought it would be unhealthy, but now that I'm thinking about your company, it seems like it could be healthier living in the metaverse. What do you think?
No, it's an excellent point. I always thought about that myself in terms of getting so connected and being completely integrated, and then how do we take care of ourselves if we're sipping smoothies and doing all of that. And I think that as we've seen through the pandemic, people have gotten a lot more engaged. I mean, the direction was already there. We were getting into more connected healthcare, but there was an unwillingness from individuals to engage, read instructions, and figure that out. And that got all accelerated. So I really think that as long as we as individuals, as companies, continue to innovate on this idea of digital tracking, home-based labs, but make sure that it's clinically relevant, like it's actually not lifestyle, but really rooted and based on good science, then we can actually get that insight. And I think that the consumption of care for basic episodic visits, for general care, is going to happen more and more in the home, where individuals are engaged, and then they're going to go in for treatment into the providers or into the hospital.
By the way, so first of all, the Bruce Willis movie I was thinking of was Surrogates, but in this and WALL-E, we didn't do anything. People in those movies and those fictional, future forecasts did nothing. And you're right. During the pandemic, people did a lot more. Paul, for example, got a Peloton bike and was riding every day. A lot of people were trying to figure out ways to do exercise and ended up doing even more in lockdown than they would have before. But what kind of solutions are you able to provide now, Waqaas, in terms of, for example, health monitoring solutions? What can Biotricity give us?
Great question. So, we started out, we had the diagnostic product, which was really available for high-risk patients. And so, when I talk about high-risk patients, I'm talking about patients that can have a heart attack or a stroke, and you don't want them basically sitting at home waiting for the data to be collected and then returned back and downloaded because you're worried about something's going to happen. So that was our first product, and it's a smart device. And so when you put it on to a patient and you send them home, it'll look for the data, and when it detects an emergency or an anomaly, it actually alerts your doctor and gets you back into the hospital.
So it's like a bracelet or a wearable that detects, like it does an ECG and detects your pulse and...
Correct. It's a small little. It's a device of a mouse, and it hangs around your neck and makes contact with your skin. And that device saves lives every day. And then we've taken that technology and we've simplified it in two products. One which was just FDA cleared last week, which is a patch that gets connected and collects your ECG and accelerates your diagnostic response time. So it's a Holter product, but it slightly highly condensed. And then we have a consumer product, which is collecting your ECG long-term for weeks, months, years, as long as you're wearing it. And this is really good for bikers. This is really good for individuals who had an issue, but they're fine now, but they want to track themselves. Really a lifestyle play.
So is this, I guess the digitization, if you will, of healthcare, is that going to drive costs down? It does in every other industry.
Good point.
No, excellent question. So I would say, 70 cents of every dollar in the United States is spent on chronic conditions. And so we've been seeing a huge movement in telemedicine, right? But telemedicine is episodic care. It's 30 cents on the dollar. So the real issue is exactly what you're talking about, right? The people who are sitting at home, they're not exercising, they're not engaging, they have to go in and out of the doctor's hospital all the time. People with cardiac issues, people who we're servicing at Biotricity and we're focused on. And the reason is most of these individuals don't actually have technology available to them to get insight. So they get really on it. The doctor says, this is going to be a problem. You really have to do this. And for a week or 2 weeks, they self-manage. But because they have no data, they have no device, they have no technology to tell them that it's actually doing something, they drop off the wagon. And that's what we're doing. And to your point, I think that's really going to drive cost downs, but we need to continue this trend.
So is this again, kind of some of the telemedicine, is that just a function of the pandemic, or is this a big trend that's going to continue?
So I think telemedicine is going to get bifurcated. So part of it is going to stay. So, the people who have a flu, it's convenient and whatnot. But I think there'll be a drop there. And then there's going to be telemedicine for chronic patients. The problem with chronic patients is, you need blood work, you need diagnostics, you need an actual test. I mean,
right.
You cannot tell a cardiac patient, are you actually having arrhythmia or not, if you're feeling palpitations without running some sort of test. And that's where companies like us have to continue to innovate
right.
and provide those technologies so that you can get that data integrated with telemedicine and provide care. And that's that 70 cents I'm talking about.
All right.
That's what's going to move the needle.
All right, Waqaas, thank you so much. We appreciate it. Waqaas Al-Siddiq, CEO and founder of Biotricity. Talk about the future of medicine.